Well, I started playing golf when I was 8 years old and went to college at Northwestern when I was 19, spent 4 years there, and at the end of that I thought I was good enough to turn pro. I'm a very classic golfer. I'm a positional player. I like to play to my strengths, and obviously that skill has been able to get me to number one in the world. I was at the US Open and just felt some mild pain in my wrist while I was playing, but I hit one drive on the 15th hole and felt something snap.
He got his club a little too vertical and had to forcefully supinate his left hand and wrist to impact on the ball, and that tore his sheath.
I asked around, especially some of the golfers that had gone through wrist issues, including Jim Furyk and a few others, and who they'd seen, and obviously met Dr. Weiland up in New York at the Hospital for Special Surgery, and as soon as I met him, I got a good feeling of trust, and that he knew what he was talking about, and I loved the fact that he was just very straightforward with his answers, and had a great outlook for my wrist. But that's always the worry, whether I'd be able to come back and play to the same level. I've certainly known some other pros that have had very similar injuries, if not the same injury, and a few years later they're still struggling. So I'm very grateful to Dr. Weiland for his expert care and getting me back to playing to a level where I've been able to get to the top of the world rankings.